So Boom, we've been talking quite a lot about stress, and we often use that term interchangeably with the autonomic nervous system. In the autonomic nervous system, we've got our sympathetic nervous system, or the fight or flight response, and our parasympathetic nervous system, or rest and digest. So as an example, if you're a gazelle in the savannah and you get chased by a lion, you need your fight or flight response. You need your sympathetic response. Fast heartbeat, high blood pressure, ability to run, blood going to your muscles, eyes wide open. Once you're back safely in the herd, once you realise that you're away from the lion and you're in a deep sleep with your fellow gazelles, you can then rest and digest. You can have your dinner, your gut starts working, your heart rate comes down, your breathing comes down. So we've got the fight or flight, sympathetic, the rest and digest, parasympathetic. And of course, it's not just if you're a gazelle in the savannah. This applies to all of us all the time. In fact, right now, our sympathetic and our parasympathetic nervous systems are in kind of harmony. Tell us more about how that applies in everyday life, and the balance between the two and how it might change.
So I'd like to take this in the context of a symbol that everyone can understand. So let's put up the yin-yang symbol, which is this circle with an S in the middle, with black representing the sympathetic nervous system, or the yang, and white representing the parasympathetic, or the yin. Now, when you're asking this question in a normal environment, we should be very flexible. So if you think about the yin-yang symbol, being able to flex, so this S bends away towards sympathetic dominance. Let's say 70% of this circle now is covered with black, 30% in white. You are doing something stressful, say going for a run, running for your bus, or running from the line. Although if you were running from the line, I would imagine you're 99% sympathetic dominance, right? Now, in this state of sympathetic dominance, a few things happen. Your battery starts to trickle down. If we can imagine our charge as a battery, or our energy as a battery, stored in a battery, in sympathetic dominance, your battery will discharge more quickly. And using the analogy you said, once the gazelle has run away safely and is back deeply sleeping in the herd, in the middle of the herd, you shift this yin-yang symbol to become dominantly parasympathetic. So 80% white, or yin, and 20% yang, or black. And in that state, for 8 hours of sleep, you're charging your battery up. And let's say if you were a body battery, you could charge in 8 hours to 100%. So you wake up the next morning fresh, full of energy, and ready to hit the day ahead. Now, in the usual state, this yin-yang symbol at 50% should be able to flex naturally, very quickly, towards sympathetic dominance and then towards vagal dominance. And sympathetic dominance and vagal dominance. And it happens many times.
And just to be clear, vagal dominance is parasympathetic.
Is parasympathetic.
It's the word that we use the same. Yeah.
So the vagus nerve is the main nerve that controls the parasympathetic expression in the whole of our system. So this ability to flex and fluidly move between the states is a marker of autonomic nervous system flexibility.
Yes.
And sometimes we see this on a wearable, like a Garmin watch that I'm wearing, or a ring, as a heart rate variability, which is the index of autonomic nervous system flexibility. And in general, we want the heart rate variability to be higher. The higher, the more flexible your autonomic nervous system is.
So essentially, we want our bodies to be able to quite easily go between acute stress, like running away from a lion, versus actually the lion's gone, we can now relax and go back to our parasympathetic state. It's that flexibility that's good.
That's exactly right. And this yin-yang symbol, I want you to see the flexibility as an S that can flex both ways. This S can move towards the left and the right to give you variable expression of the sympathetic and parasympathetic. Now, when it comes to the patient cohort, and you're watching this video because probably you've got an energy limiting condition, you have chronic fatigue, and you have an autonomic dysfunction condition that drains you. One paradigm to understand this in the context of the autonomic nervous system is to think of that yin-yang symbol being, let's say in the perfect state, 50-50, shifted downwards to say 60% yang dominance or sympathetic dominance. And this is now your new baseline state. And in this state, when you get stressed, you readily shift towards sympathetic dominance, but instead of shifting to 80%, you shift to 95% every time there's a minimal stress.
So basically your system becomes a bit less flexible and you get sort of stuck in the sympathetic fight or flight response.
Correct.
Yeah.
And although you can shift flexibly towards fight or flight, what you're inflexible about is switching back to the parasympathetic.
To the rest and digest.
To the rest and digest.
So
exactly.
why might that happen? Why might someone get sort of stuck in the fight or flight and they can't get out of it?
So this relates a bit back to our first discussion on the stress curve that we talked about. But there are many reasons. And most of the patients who come to our clinic now have a very clear reason in their mind. It could be an infection such as COVID, or a marital breakdown, or bullying at school, or some other very stressful event in their lives, including career, finance, where they live, environmental pollutants. All these things can be stressors on the system.
Stresses. Yeah.
And these are stressors that don't run away or don't come away from you just because you run away from this particular lion.
Yeah.
This is more akin to a chronicity of stress that is there day and night, 24/7 for months or years on end. And these are things that are very difficult to shake off because we live in that environment where we're now clunking or shifting into a state where our baseline state is no longer 50-50. It's 60% dominant sympathetic and say 40% parasympathetic.
Which is not how our bodies were built, were they? They were built to be able to run away from a lion and then go back to relaxing. So one could say that our modern lives are not really designed for how our bodies were meant to be. It's almost like we have these chronic stresses all the time with our social media and our constant connectivity and our boss needing us to reply to an email at 3 a.m. Our bodies can't flex back into rest to parasympathetic because of that chronic stress.
That's exactly right. And if you look at the stress curve, what is the straw that breaks this camel's back in terms of the stress curve is often perceived as a singular event, such as COVID or losing your job. And this is often not it is the trigger, but it's a trigger on top of many other things going on. And if we think about some of the acute triggers, of course, COVID or an infective trigger is one common way in which you shift this chronicity of stress. But on the background could be things like an emotional and mental chronic stress state. And it's exactly those points that you raise. There's also something that we see as patients go on in their chronicity of autonomic dysfunction and stress. And that is what we call, or what you had a good phrase for this, Mel, which was the kind of life or living life which is not aligned to values.
Yeah.
And this stress, which comes on later on in the process, is one of the most deep-seated stresses that requires a deep introspection to look at what you're living life for and where your station in life now is compared to where you want it to be. This is tough because if you're limited in energy, you've limited capacity to do the things that you feel you ought to be doing, that you think you could be doing or you were doing before your illness.
Or you want to be doing.
And you still want to be doing. It's a tough gig because it's something that your body is telling you you can't do now.
Yes.
So how do you overcome that?
And sometimes the body shows you what it needs to, it shows you that you're not living a values aligned life by some of its manifestations of stress, doesn't it? It's a sort of way of saying it can't go on as it is because of these chronic stresses.
Yes, that's right. And you'll be looking elsewhere at your friends and other people or your colleagues who appear to have the perfect life. And they had COVID, but they shook it off, and now they're training for a triathlon and still working very hard at work. That's not you, though. And you shouldn't compare yourself to another person because this is your personal situation.
And that in itself is another stress, isn't it?
Yes.
Yeah.
So
which puts you into fight or flight.
So the point here is to think of that yin yang symbol. 50% is where we ought to be, and where we are now is say 60% dominant sympathetic tone. What we need to understand is what the factors that were bringing us into this
Yes.
place where we're
Yes.
chronically holding on to the stress, which
Yes.
means we can't be flexible to shift towards parasympathetic.
Yes.
And as we said, just to reiterate, physical stress, you have immune stress, and some of our patients will have allergic phenomena that, for example, antihistamines can be very helpful with. Some of us have continued orthostatic physical stress, which means whenever we stand up, we drop our blood pressures, we need the adrenaline surge or a shift towards fight or flight to keep us functioning well.
Yes.
And these are things that maybe your doctor or your syncope specialist can help you with, because there are strategies to help with orthostatic stress or blood pressure stress, strategies to help with immune stress.
But these aren't all the types of stress.
That's exactly right.
And so while the doctor is focusing on the orthostatic stress, what you said in another talk, actually we really need to be focusing on all the other, and maybe even just make a list or a mind map of all the different types of stress in one's life. Some of it's good stress, but still stress, and how we can, if we can modify it, if we can't, and if we can, how we can.
Yes, that's exactly right. So we touch upon emotional stress, which goes hand in hand with mental stress, and these two facets of stress can cloud how we see relationships at work, at home, with family members, and actually having a long hard think about all those stress components to down-regulate stress and shift back up to parasympathetic dominance, or being able to be more flexible towards the vagal or parasympathetic dominance, is one way to think about this.
Because the first step in managing it is actually naming it and understanding and having a concept.
That's right.
Thanks, Boone.